Welcome, Lipstick and Logic. Why are we calling Lipstick and Logic?
Well, obviously it's because of my brain.
Wait, are you Logic or are you Lipstick?
I'm both. Can't something be both?
Well, I don't think I'm both.
Well, we decided to create this
Because
on both of our platforms, I know on TikTok, you're doing a lot around attraction.
yes, the expert in the science of attraction.
There you go, Dr. Love, right here. And these formats only really allow us to talk for like 90 seconds.
Yeah.
And I know that I do a lot around how to stay looking like yourself for as long as possible and not drifting.
So you're saying looking natural.
Looking natural.
Does everyone know you coined the word perception drift?
I don't know. I think others are trying to take it, but I
It's
first
your
published
name,
it.
perception drift. In other words, after you look at something longer, you start to find different things attractive.
Right.
Yeah.
So there's a lot in that, and I think the point of us getting together is historically we've really educated physicians,
Right.
And I think that we really wanted to now take the opportunity to educate our patients and consumers at large.
Because we're always talking, I mean, you and I were together a lot, and we're always talking about things, even in the middle of the night.
Pillow
And
talk.
here's our opportunity to share some of those thoughts with everyone else.
Absolutely. So hopefully you like it, guys, and we're always open to your suggestions. So
Yeah.
make sure you leave comments below on things you want us to tackle in future segments.
And the juicier the better. Nothing is off limits. You know, in my TikToks, which are exploding lately, I'm talking about the science of attraction, but it's really turning into the science of relationships.
Because, I mean, why do people want to be attractive?
Yeah.
It's so that ultimately, is it to just get attention, or is it ultimately, is it for that immediate ego boost, or is it ultimately to land in a relationship? I mean, they have to be attraction has to bring in the person.
Yeah, but what if someone's already in a relationship? They want to be attracted to someone else?
I don't know. I mean, you're the attraction doctor.
Yeah. You know, it's interesting, isn't it? It's really, if you think about it in depth, it's interesting. Why do people want to be attractive? I mean, that's what we do every single day. We make people more attractive. At least that's what I'm always aiming for. But why do they want to be attractive?
I think it's because it makes you feel better when you are more attractive.
You feel more confident.
You feel more confident.
Okay, but if you're more confident, you're more attractive. So
right,
what
then
comes first?
What comes first? I don't know. I recently read that it actually is the chicken that comes before the egg. That's been established. Why? Because you need the slime that the chicken creates in order for the egg to survive. So the egg could have never survived if the chicken didn't come first.
Wait a second. Is it a male or a female chicken? Because the male chicken's part of this too, right?
Well, I'm just saying that the female needed to exist first. The female chicken needed to exist first.
Is that right?
In order for the egg to actually come. So
the man's just a bystander. Or the male
that
chicken.
was your logical deduction, not mine.
Okay.
But I do agree. What comes first? Is it attraction that breeds confidence, or confidence that breeds attraction?
So there's been some studies out there that show 70% of our self-esteem or confidence is wrapped up in how we feel about our appearance. So there's definitely a component of feeling good about your appearance that then leads to confidence, or attraction. But they kind of go hand in hand. But then the question really becomes: is why do people want to be attracted? Do we like attention? Do we like other people to respect us, to look up to us, to appreciate us? And all those are things that we associate with being attractive. It's not just for romantic love, is it?
Right. So you talk about something that I've noticed with some of my patients. Sometimes they do aesthetic procedures. These are the same people that want to look natural, right? But it might be very, very happy, but after perhaps one of the multiple interventions that we do, they don't get anyone to notice that they look better. Like, someone doesn't necessarily compliment them or give them feedback that they look really pretty and they look more attractive. And so then that started making me wonder, like, is that something, the end goal from some of the procedures that we do, that people want that, like, reinforcement after a procedure that they look more attractive? Like, they want to be noticed more.
But what does that mean to look more attractive? Because in my opinion, it's someone looks at you, they don't really know what you had done. And this
Right.
goes to your perception drift and to your keeping it real.
Yep.
It's that, people want others to notice them, but
Yes.
they don't want them to
Notice them for the right reasons, of
think
course.
that anything done.
Right. Get noticed for the right reasons.
Yes.
So that means compliments. Like, oh, you look really good. What have you been doing? Have you lost weight? Have you changed your hair? Like, I mean, those, they want to get noticed, which is...
By who?
And I think by anyone,
so not just men, this women too,
it's
right?
women too. Yeah, I mean,
and maybe more so women.
Like, why do women, like, I'm going out with my girlfriends tonight, right?
Yeah.
But like, why do women like pick out their outfit when they're going out with their girlfriends? I mean, it's not because I'm trying to like, get hit on at the bar.
I hope not.
I'm not trying to get hit at the bar.
Are you wearing the yellow dress tonight?
I'm not wearing the yellow dress tonight. You don't have to worry.
The yellow dress, the skimpy yellow dress with barely anything underneath it.
Okay, we don't have to
Okay.
go there. That's a different segment. But
Yes.
it does raise, it's like, what are we trying to achieve sometimes from these procedures, right? It's like we have to, like, we get to be in this unique position as these objective observers. Well, we think we're objective, but like to really dissect what people are trying to get from us, right? First, I want to look natural and I don't want anyone to notice that I did anything.
Right.
Okay. Now, but I want to be able to feel better from what I'm doing. Okay. I don't want to wear makeup. I want to be able to feel confident with no makeup. Okay. But then people might feel like they're upset from the procedure you did if they didn't get noticed, or if they didn't get enough compliments, or if people didn't tell them they looked prettier. So then it starts to beg the question, like, what are we really doing?
What's the goal?
What's the goal?
What are you aiming for?
Right.
And that's an important thing that we have to discuss with our patients, right? Because some come and say, I want people to notice I look different. Some people come and say, Dr. Ann, I don't want anyone to know I had anything done.
Yes.
It's a different outcome. And I always say, like, when I'm teaching my fellows and residents, and this is an important lesson for the fellows and residents who are listening, when is the procedure done? Like, when are you finished?
It's like the piece of art. Like, when is it done, right? Like a masterpiece is never really done.
When are you done? Da Vinci never finished, right? Because you can never be happy. But when are you finished? And when I'm in surgery, if I'm doing a nose or I'm doing a facelift or I'm doing eyes, it's like, how much skin do I remove? How much more of the nose do I pull the tip up or thin the tip? The answer to that question, which my fellows and residents almost never get, at least they don't get it at first, they get it by the end of the year, is what's going to make the patients happy? What's going to meet their expectations? And it's the same thing like you do a laser procedure. Like, how much do you do or how much filler do you put in? You got to make the patient happy, but it's got to be within reason, right? Because you don't want them to look strange or unnatural, weird.
Right. So it's like the evil of good is perfection.
Yeah.
In that, and then you've talked about it, like the standard deviations, right? Like there is something about which are the most attractive faces. There's like that one paper, and it's like the one that looks closest to average.
Yes. Conophilia. It's a power of the average. So we love the average. The more something's average within a reference range, though. So if your reference range is big, the average changes.
Okay.
Right.
But then it's like remembering that. So like if you're already starting off really, really pretty, and now you're trying to like make something a little prettier, you're a lot more likely to
Make it
shift into looking unnatural, right? And get out of that reference range.
Right.
And so that's like something that I'm always negotiating with my patients, like recognizing that they're already so beautiful.
Okay, so the question that I'm going to ask you, Dr. Fabi, I'm sure you get this, is how do those Hollywood stars look so unnatural? Don't they go to good doctors? What's your answer to that?
So that was something that, because you and I perseverate on all related to beauty, whether it's what makes people really attractive. I mean, we want to pat ourselves on the back and say it's because of our procedures, but like you see these perfectly beautiful people, according to like the golden ratio, and they're still not attractive. And somebody who's not perfect still gets all the attention when she walks into the room for all the right reasons, not the wrong reasons. So it's like, I recognize, that's one obsession of ours. And then like the other obsession, at least for me a while ago, was like, how does that person like end up on the front cover of like, a magazine when I'm checking out at Whole Foods? Like what happened there? Did the doctor or provider
what happened? They look weird.
That looks weird, right?
Yeah.
Like this is like a face that was so beautiful,
right.
And like now it's, got these slanted eyes, that are upturned and, lips that are like coming out of their face. And it's like, so where did it go wrong? Did the person not recognize that they were starting to look peculiar? Do they want to look peculiar? And who did the procedure or intervention that thought that it actually looked okay? Right? So those were like things that I started.
So I think you're right, because they always look a little bit off. Now, a lot of our friends are in Hollywood, but they don't, we know who they do.
Yes.
And we just know who they do.
Yes.
People, the patients that are the Hollywood stars that look strange, almost always, I'm not exactly sure who did it.
Right, or are they hopping around? Because
They're
we see
right.
those people even in our practices that are like, oh, I went and got this done. I get my injectables here. I get my neuromodulators here. I got this at Groupon. Like, and they're jumping around. I was in Texas, visiting my girlfriend, and I went with her to her doctor, and
I don't think they're seeing the most reputable doctors all the time, or the most experienced doctors.
fine, or providers for that matter,
providers,
right?
yeah.
And so, so that was something. But then, with all of that aside, does the person not notice, right? So then that started making me really sensitive to this, because I definitely didn't want to participate in making people look strange. That's, it takes away my joy, and I don't want to be a part of the problem. And also for myself, I never wanted to look weird. So I started wondering, like, what's going on in the psychology of that individual that is allowing them to look in the mirror and still identify with themselves and not think that perhaps another syringe might make them look too weird.
But you see this all the time.
Well, we see it all the time, and we see it with our patients. And so something that prompted me was, over and over and over, I'd get patients that are like, I want to look natural. Make sure no matter what, like, I'm scared, I don't want to do this. I trust you. And so I'm like, okay, you trust me. Wonderful. We do it. And then like 2 weeks later, they're like, I want more. I'm like, but you just told me 2 weeks ago that you want to look natural.
Right.
So then, like, where did the disconnect occur? Right? And so I think that the closest place that we can look at that is in the literature of body dysmorphic disorder, which is your friend and colleague that came up with that term.
Catherine Phillips.
Right, Catherine Phillips.
Yeah.
It really, when we think about this, it's like, how is this body dysmorphic disorder? Is this how it presents? But then you start to wonder, my gosh, I mean, what's the incidence of body dysmorphic really? It's like,
It's as high as 12% in patients who come to see an aesthetic physician, but it's probably like 1% to 2%
of the general population, right? So then it's like, are all these people developing body dysmorphic disorder? And I don't believe that that's the case, right? Although I do believe that that is a spectrum, just like with everything else. Right. And I think that what starts to happen, if you really read their literature, if you understand what body dysmorphic disorder is, what's happening in that individual's brain is that they have an inability. It's there's global processing and local processing. And it's how we perceive or take in maybe a line above the upper lip or a wrinkle around the eye in the context of our global face, right? And generally our brain is able to reconcile that line in the frame of the entire face. But when you have an imbalance between local and global processing, that one line cannot be seen in the context of the whole face. So they perseverate on it, right? And so what we learned from her was that you perseverate on it for like greater than 2 hours a day, and it potentially, is considered pathologic when it interferes with your ability to, perform daily functions. And so are these patients? No, it's not. They're not a pathology, but they've definitely, once you get rid of one line, now they're noticing the next line. And I think what happens is that, and this is what I proposed when I called it perception drift, is that your perception of yourself starts to drift as you do these interventions, because your brain quickly accommodates to its new baseline. And so now this baseline is free of the original line that you were bothered by, but now you notice the line next to that.
So for people who don't know about dysmorphic disorder, we should define it. It's a pathological diagnosis. It's actually psychiatric illness of people who have a distorted view of themselves.
Correct. And in which case there are, especially SSRIs, medications that are used very similar to the ones that are used for anxiety and depression that are used to treat
or behavior treatments as well.
Right.
And so you need to see a specialist, but they see something in the mirror that no one else sees. And the classic example is anorexia.
Correct.
Everyone can understand that. Someone looks in the mirror, they think they're fat and they're really skinny. That's a classic example. The three most common areas for body dysmorphic disorder where someone looks at something and doesn't recognize what they see something no one else sees is the hair, the skin, and the eye, and the nose. The hair, skin, the nose.
Which is basically our field, right? I mean, in a dermatology clinic, it can be up high as to 12% of the individuals that come to our practice, which is probably the highest in any practice. But I think
rhinoplasty is like 30%.
30%, right?
Up to 30% there's been reports. But it's probably, anyone coming to see a cosmetic physician, it's in the 8 to 12% range. And these patients come in, and there's nothing we can do. And in fact, if we treat them, we'll probably make them worse. So the goal is for them to see psychiatric help, because nothing we do is going to make them better. And those patients start to look distorted, and they look bizarre, and they look strange. And we all see those people on those talk shows.
But something
call it
that's
a
really
dysmorphic
important
disorder.
with body dysmorphic disorder, something that I learned from Dr. Phillips, is that it's usually something that is not perceived by others. So it's a fixation with something that's actually not perceivable. So, which also enlightened me about this concept more about perception drift, because in this case, you're not necessarily perseverating on it. You're just bothered by your nasolabial fold. You just want to, efface it a little bit so that you can look a little bit younger. That's nothing too much to ask, right? And then you do it, but then you start to notice something else. And in noticing that other thing, like a tear trough, and then you get rid of that. And it's not like you're perseverating on it. And it's not that it's impairing your daily function. And it's not that it's pathologic. It's more that you think that it's appropriate to keep doing this. And then your provider keeps doing it because, to your point, we want to make our patients happy.
Okay, but this is different. So your perception drift is different than body dysmorphic disorder.
Absolutely.
Okay, how are they different?
In that they're not necessarily perseverating on it more than 2 hours a day.
Yeah.
It does not impair their daily function.
Yeah.
It is generally something that is actually perceived by others. I mean, people see it, but it's probably not as much as you perceive it yourself. And in this case, it's not that there's not the psychiatric condition
Yeah.
associated with it, right?
But is a perception drift from what's natural or normal? Is that what the perception drift is? Or is the perception drift from...
Your perception drifts of what you originally looked like. That is what essentially the drift is from, because your brain has to quickly accommodate.
But don't we all do that? Like, if you look at a picture of yourself from 10 years ago, you're like, oh my gosh, when did my face change so much? We all do that.
Yes, that's the point. Because your brain would have a schizophrenic event if it remembered how it looked like in real time of you at 21 years old, and you're now looking at yourself in your mid-40s.
So we adapt all the time to how we look.
So our brain constantly adapts to what we look like.
So if you put a bunch of filler or toxins or surgery or laser and you overdo any cosmetic procedure,
then
you start to adapt to that.
You adapt to that. And so this is actually something that we went on to publish a little further.
Yeah.
And so this has become a focus of my interest, and this is like visual adaptation. And so in a study that I did with Kate Goldie, it's not just after you have an intervention that you quickly forget what you look like, and now you start to shift your baseline, but also your preference. So if our visual systems are very malleable. So what you're consuming on social media, what your visual diet may be, influences what your preference is. So in a study that I did with Kate, we essentially gave the layperson images of larger lips. They were 20% larger than the original image. We skewed them to be
You also
larger.
get smaller lips too.
Yes. And after just 2 minutes of consuming this diet of larger lips, when they were asked 2 hours later what lips you preferred in a range of 5 different lip shapes, they went with the larger lips. 2 weeks later, they're invited back. We give them lips that are smaller, like 2 deviations smaller than the original lips, like tiny lips. And exposed for 2 minutes, 2 hours later, they're asked to choose, again, in a range of 5 different lip shapes, which lip they prefer. And now they prefer the small lips. So that same individual had a different preference that was directly influenced by what their visual diet was.
So I love that study. One of the things I like most about that study, if you really read into that, I'm sure you know this because you did it, is that they never changed their naturalness. While their attractiveness fluctuated based on what they were exposed to, what they thought looked natural never fluctuated. So I think that goes to your perception drift. Like, you see something over and over again, it changes what you find attractive, but it doesn't change what you think is natural. So if someone themselves has too much done to themselves, they start to think they look more attractive, or they find that more attractive, but they don't see it unnatural.
Which is then comes to the paper that we wrote again on this, which is like aesthetic delusions. Like the bias of the aesthetic provider, right? So then, to your point, if you're in a practice where you're constantly seeing, near to perfect faces that have been surgically modified or modified by an injectable or other procedure, then your baseline of what you think is attractive starts to shift.
Yeah.
And so then how can you not start imparting that onto your patient?
So if you look at a doctor and him or her or their spouse looks weird, do you run?
Right.
Yeah. I always say, like, if you go into a doctor's office and all the nurses look bizarre and his or her spouse looks bizarre, I think our partner, I think it's time to say this person probably has a distorted vision. They have an aesthetic bias. They don't even realize what's attractive anymore. And it happens all the time. And we see it rampant in our fields, right? Like, we walk to some of our meetings, you're like, oh my gosh, like some of our colleagues, I hate to say it, I would never call it out, but we all see it, and some of their spouses too.
Right. And so it's constantly like checking ourselves, right? I even do it with my fellows who have like a new eye, and I look at a photo, I'm like, do you see the difference? You know, and they're like, oh my gosh, yes. You know, and because for me, it's like there isn't that much of a shift. And maybe that's a good thing, you know, after an aesthetic
But
intervention.
so how is that you've kept it real? Like, you know, think about it, like a lot of people in your field, and listen, I see it more with women than men in our field. I do.
Yep.
How have you kept it real?
It's a practice, just like anything else. How do you keep balanced? How do you keep sane?
Okay, but
How
you're
do you
around
keep
people
relaxed?
all the time who are doing
You know?
aesthetic treatments, and people are concerned about their appearance, and like, how do you keep balanced on it, or how do you keep yourself measured so you yourself look beautiful and natural, and your patients don't?
I lean a lot on lasers and skincare to keep my skin looking good, right? Because we know that, and maybe these are doctor's orders. So doctor's orders, to keep it real. You know, leaning on lasers and skincare to just keep the quality of your skin good, right? Because if you just address your skin alone, you can look younger and healthier if you did nothing else. And those are studies that have already been
but you
done.
can overdo skin treatments too, can't you?
Not necessarily. I
You
mean,
know,
you
remember
can.
the chemical peels from the CO2.
Right. I
back
mean,
in the day?
we've advanced a lot,
Yeah,
right?
the big
We're not
chemicals.
going and doing dermabrasion,
Right.
you know, and so there's that, right?
So
It's-
most of the time, skincare is you're not gonna make someone look bizarrely unnatural.
and with lasers and devices either, right? The second thing is going to a provider that you trust. So I go to the same person. I don't jump around. I go to the same person, and that person knows my face. They started with me, you know, years ago. They can look at photos to compare what I look like, and you want your provider to be looking at your photos from before, not just the person that presents to their chair today, right? So that they're aware of not making you look different than who you are.
Yeah.
So trusting the provider that you go to would be like my second doctor's order.
Okay, but that's a deeper question. Like, how do you know to trust someone?
Right. I mean, we're in the privileged position that we get to see these people speak. We can get an idea of their aesthetic eye.
Yeah.
We look at their before and after photos to see, do these people look a bit distorted? It's not just the person with the most followers or engagement on social media, right? It's like the individual that when you look at their library and gallery of photos, you're like, this aesthetic aligns
So
with
you're
mine.
saying for the consumer, the average person out there, if you're looking for a provider, look at their before and after photos?
100%. But make sure that they also take yours so that you're always referencing that as the gold standard, not just the version of you the visit before.
And does experience matter?
Yes, experience matters. So obviously, yeah, I go to someone who's experienced.
Someone
you
who's
know?
not, and experience in the procedure you're actually doing. Because like sometimes I'll have someone come to me and say, you know, like I'll give you an example. I'm board certified to do brain surgery. You don't want me to do your brain
Of course
surgery.
not.
You want me to do your facelift, not your
Right.
brain surgery, right? So even because someone's board certified in something, doesn't necessarily mean they're the expert in it. So you got to
Right.
find someone so if someone's really good at breast augmentation, doesn't mean they're good at tummy tucks or facelifts.
I see it all the
or
time.
vice versa.
People go to aesthetic providers. That doesn't mean that they have every single laser and know how to operate them, you know, with fluidity. Like
Right.
that you want somebody that just has all of the devices and that they constantly are operating on them so that they know how to apply them to your particular skin type and your particular issue.
So find someone experience in which you want to have done.
Exactly.
Okay.
So that would be doctor's order number 2. Doctor's order number 3. What's your doctor's order?
You know, that's a great question. I think I agree with you on a lot of this. I think experience matters quite a bit, and I think you want to go to someone who says no.
Yes.
And I cannot tell you how many patients have come to me over the years who are like, Dr. Diane, I came to you because you saw my girlfriend and you told her no, and I knew if you would say no, then you must be someone who's reputable. And I find myself probably saying no half, if not more, of the times to people come to see me.
Right. And so that goes with number 2, which is trust the provider that you see.
Right. But if someone says no to you, I mean, because, look, let's be honest, it's very easy for me to throw another syringe into someone
Yes.
or to do add on a procedure. But if you want to do what's in the best interest of the patient, you have to think about them holistically, and part of that is making sure they look natural and beautiful, and it's valuable for them,
Yes.
and you're not taking advantage of them. So I will often, I'm not just their aesthetic provider, I'm their consultant, I'm their friend, I'm I'm there to help them reach their goals. I'm their steward.
Right.
You
So
know?
I'd almost add to that 3 is like going to someone that will refer you out if
Yes.
they're not the best person to do the job.
Yes.
So I refer to a facial plastic surgeon in my local area all the time, rhinoplasty to get that done, because sometimes building up the maxilla and doing all the laser for your rhinophyma is not going to necessarily bring down that nasal bridge, right? And then you need a rhinoplasty. I can't do it all. So my CO2 is amazing, but it's not going to bring up your forehead. And so sometimes you need a forehead lift if we're trying to really accomplish what needs to be accomplished. So, having somebody that knows experts, respective experts in their field that can guide you, because I agree with you, we're like stewards, we're guiding them along their path. And if they're really going to be with us, and my goal is that they're with me for 20, 30, 40 years, they're going to need more than just me. They're going to need an integrative medicine doctor to work them through menopause. They're going to need somebody that's going to perhaps optimize their nutritional status. They're going to need definitely an orthodontist to help them rotate their teeth and expand their palate. And those are things that I cannot do.
So those are the doctor's orders for today.
Yes.
All right. I think it's time for us to go because we have a hot dinner day tonight.
Yes, we do. So thank you for tuning in. Lipstick and Logic.
See you soon.